Hey guys, welcome to my channel Document School. If you're new here, consider subscribing and hit the bell icon so that you don't miss out on the new videos. Today we're going to discuss about Hirschsprung disease. Hirschsprung disease is a condition of the large intestine that causes difficulty passing stool. It involves missing of the nerve cells in the muscle part or in the segment of the large intestine or in the whole large intestine. Now these nerve cells are important because they cause the peristaltic movement to happen, which in turn helps the digested food, the completely digested food, to get passed along the gastrointestinal tract. If these nerve cells are absent or missing, then this peristaltic movement is absent, which in turn leads to accumulation of the digested food particles prior to the muscle part in which the nerve cells are missing. It occurs in 1 out of 5,000 live births and has a 10%, and the 10% of all the cases that occur in children have Down syndrome. Pathogenesis. The enteric neural plexus develops from neural crest cells that migrate into the bowel wall during embryogenesis. Hirschsprung disease, also known as congenital aganglionic megacolon, results when the normal migration of these neural crest cells from cecum to rectum is arrested prematurely or when the ganglion cells undergo premature death. Now, these intestinal segment which doesn't have any ganglion will be lacking both Meissner submucosal as well as Orbach myenteric plexus. Now, the mechanisms underlying the defective neuronal crest cell migration in Hirschsprung disease is quite unknown, but a genetic component is present in nearly all cases, and 4% of patients' siblings in Hirschsprung disease are affected. Heterozygous loss of function mutations in the receptor tyrosine kinase account for majority of familial cases and approximately 15% of sporadic cases. Mutations in at least 7 other genes encoding proteins which are required for the enteric neurodevelopment have been linked with Hirschsprung disease. Now, even though the involvement of the genetic component is taken into consideration, it accounts for only less than 30% of the patients, which shows that there might be other defects which are yet to be discovered. As penetrance is incomplete, modifying genes or environmental factors might also play an important role in Hirschsprung disease. Sex-linked factors exist since it is more common in males, but when present in females tends to involve longer aganglionic segments. Morphology. Diagnosis of this disease requires documenting the absence of the ganglionic cells within the affected segment. The ganglion cells can be identified using hematoxylin and eosin staining and by using immunohistochemical stains for acetylcholinesterases. Rectum is always affected and the length of the affected segment varies widely. The defect always begins at the rectum and extends proximally for variable lengths. Aganglionic region is the appearance of the aganglionic region is grossly normal or contracted appearances, and the ganglionic region, that's the normal large intestine part, undergoes progressive dilation in time and becomes massively distended called megacolon, causing stretching and thinning of the colonic walls so much so that it ruptures, and mostly the rupture is near the cecum. As you can see here in the figure, the affected part or the part which doesn't have any ganglion cells has a contracted appearance, and the part just prior or proximal to the affected part is the normal part of the lung in large intestine, and it is dilated, and the stretching or the dilation causing the stretching of the colonic wall causes its rupture, and these dilations or distensions can be as much as 20 centimeters in diameter. Clinical features of Hirschsprung disease. Hirschsprung disease typically presents with a failure to pass meconium in the immediate postnatal period. What is meconium? Meconium is the very first stool passed by the infant right after the birth. Ineffective peristalsis progresses to abdominal distension and bilious vomiting. The affected part or the part which doesn't have any ganglion cells in it will not take part in the peristaltic movement of the normal part of the large intestine, thus making the peristaltic movement ineffective. And this ineffective peristalsis causes abdominal distension and bilious vomiting. Bilious vomiting is nothing but having bile present in your vomit. Major threats to life because of this ineffective peristalsis are, and the much more features of the Hirschsprung disease are enterocolitis, fluid and electrolyte disturbances, perforation, and peritonitis. These are the major threats to life caused by Hirschsprung disease. The treatment of this disease is simply surgical resection of the aganglionic segment followed by anastomosis of the normal proximal colon to the rectum. That's it for this video. I hope to see you guys in the next video. Till then, bye bye.